Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Do you think you have symptoms of type 2 diabetes? Do you have diabetes already and are learning more about how to control it? Well, on today's program, we are going to answer these questions for you, and we invite you to phone us at 304-296-0041 for Health Talk, brought to you by Mon General Hospital. I'm Jim Stallings, along with Kay Murray. Good morning, Kay.
And I think by now most of us know what causes it, but we'll expand on that as well.
With us is Dr. Nadeem Haq. He's an endocrinologist on staff at Mon General Hospital. Good morning. Welcome to the program.
Good morning.
You know, every now and then people say, I think I might have diabetes. And I say, why do you think that? And they give me a list of reasons. But there's pre-diabetes. Some people have diagnosed with pre-diabetes. But what are some of those early symptoms that people get that might indicate they have pre-type 2 diabetes?
That's a good question. Most people in pre-diabetes stage don't have any symptoms. And that's a major problem because it's a symptomless disease when you're in pre-diabetes stage. Pre-diabetes simply means that your sugars are higher than normal, but not high enough to get a diagnosis of type 2 diabetes. For example, the fasting glucose in the morning, after 8 hours of fasting, it should be less than 100 in a normal individual. Okay. If you get a blood sugar reading over 126, 126 is a magic number, the threshold for diabetes. On 2 separate occasions, then you're a diabetic, okay? And if you get readings between 100 and 126, okay, you are pre-diabetic. Or the medical term for that is glucose intolerance.
But most people who don't have diabetes, and if there are no symptoms, aren't going to be checking their glucose level when they wake up in the morning for any particular reason, are they?
That's correct. That's correct. And that's the problem. Then we look at the risk factors for developing diabetes, the family history, obesity, the age of the individual. Okay, if you have risk factors for diabetes, you should talk to your doctor and be tested for diabetes.
I generally think that, especially men, if they have the spare tire, or women, usually it seems that overweight people have type 2 diabetes. And I know there's probably normal-sized people, I say normal size, but non-large people probably have type 2 diabetes as well, but isn't it a majority of people that are overweight in some way?
Yeah, there's a strong correlation between obesity and the development of type 2 diabetes. Most type 2 diabetics are obese, but not all obese people are diabetic. Okay, we don't know why. Okay, so there's a strong correlation between diabetes and insulin resistance. We'll talk about that in a minute. And that's one of the reasons we have an epidemic of diabetes in this country. Okay, and if you look at the statistics, there's a strong correlation between diabetes and the incidence of obesity in this country.
You know, Jim, just one thing you say about not knowing, and of course we don't test ourselves every day, but one way, again, is to get to your doctor at least once a year and have blood tests and have that checkup, because those are the things that we can do for ourselves to find out if we're headed down the wrong road.
Yeah, absolutely. As I said, most pre-diabetics don't have any symptoms. Okay, they are not tested usually, but you should see your doctor at least once a year and be tested for diabetes. Okay, but again, if you have risk factors for type 2 diabetes, you should be tested at least every 6 months.
All right, those risk factors, we talked about obesity or being overweight, and you touched on briefly about the family history. So is it that your parents had high glucose or grandparents? What about that family history?
Mostly parents and your siblings. Okay.
All right.
So the common risk factors for type 2 diabetes are the age. That's the most common, most important risk factor. Obesity.
What about the age? I mean, expand on each of these a little bit.
As we grow older, our pancreas, it starts to malfunction. Okay. And we also develop obesity, and that leads to a phenomenon called insulin resistance. Okay, the body that makes insulin, the pancreas that makes insulin, it becomes less effective as we grow older. Okay, and a part of the problem is the insulin resistance. So age is the most important factor. Then obesity, and the family history, And in women, if they had gestational diabetes when they were pregnant, that substantially increases their risk for getting type 2 diabetes in the future.
Why gestational diabetes? Why pregnant women, do they develop the type 2 diabetes while they're pregnant?
Yes, they do.
And is it the pancreas can't produce enough insulin for the baby and the mom, or why is that?
No, what happens is that when a woman is pregnant, their progesterone level goes up. Okay, and progesterone is a pregnancy hormone. It maintains the pregnancy, but progesterone, it antagonizes insulin in females. Okay, so they become diabetic.
Antagonizes the insulin in females. It's interesting that your body would do that to itself.
And in talking about that must say there's different types of diabetes. Is that correct? What are the different types?
Yeah, broadly, the diabetes can be classified in two groups, type 1 and type 2. Type 1 patients, they don't produce any insulin. Okay, their pancreas
Are they born that way?
Not necessarily. Most of them are born that way. Type 1 is more common in children. The exact etiology, the exact pathology is not well defined, but we think it has something to do with some kind of autoimmune disease or some kind of infection that triggers the whole process. And this autoimmune disease leads to the destruction of the cells which produce insulin in the pancreas. So this causes type 1 diabetes. On the other hand, type 2 diabetics, diabetes is quite different. They can produce tons and tons of insulin. Okay? In fact, they are what we call hyperinsulinic. They are making more than usual amounts of insulin. The problem in type 2 diabetes is that these patients fail to respond to the physiological actions of insulin. Okay? And this phenomenon is called insulin resistance. And there are other problems also in diabetes. For example, patients with type 2 diabetes, okay, they have abnormal liver functions, meaning that they produce tons and tons of glucose from the liver, even though you don't need that much glucose. And they have abnormal levels of hormones in their body. We have some hormones in our system, and their normal physiological action is to prevent low blood sugar, hypoglycemia. But in type 2 diabetes, their levels remain elevated, even though you're hypoglycemic.
They also call type 2 diabetes adult onset diabetes. Is that a good term for that, or do you doctors try to get away from that now?
I think we should abandon that term, because in old days, type 2 diabetes used to be mostly in type 2 in adults. Okay, now we are seeing type 2 diabetes in children also. Okay.
Are they obese children?
Exactly, because obesity is a big problem in children. Okay, so now we are seeing type 2 diabetes in kids. That was something unheard of about 20 years ago.
And again, you said that if you have the risk factors, get tested twice a year.
Yes.
Now, the glucose test that you're taking in the morning is only reading the previous 8 hours or so, right? But the every 6 months is an A1C that is more of a snapshot of the previous 3 months.
That is correct. That's correct.
And what should those numbers be?
Okay. Let's start with the fasting glucose, because it's easy to do that. It's cheap. Okay, it only costs $1 or $2 to do this test. Okay. The normal fasting glucose should be less than 100. Okay, if you get fasting glucose levels less than 100, you're not a diabetic. Okay. If you get 126 or over, okay, then you're a diabetic, type 2 diabetes. Okay. And if your readings have been between 100 and 126, you're pre-diabetes.
And
Okay.
the A1C.
Okay, the A1C is not the standard of care yet. Okay. People are trying to use A1C on a regular basis to make the diagnosis of diabetes, but there are some problems with A1C. Okay, the A1C is a really good test to see if the treatment is working or not, but it's not a great test to make the diagnosis. Okay, but in a normal person, your A1C should be less than 6.5. Okay, if you get an A1C of 7% or 8%, you're a diabetic.
Our guest today is Dr. Nadeem Haq. He's an endocrinologist on staff at Mon General Hospital. You're listening to the Health Talk program, which is brought to you by Mon General. If you have a question about your diabetes or questions about pre-diabetes, or you have a question for someone else and you're curious, you can pick up the phone and give us a call, 304-296-0041. Should you be tested for diabetes? How important is exercise in controlling diabetes? We'll talk about a couple of these topics when we come back to Health Talk on WAJ. WJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
We're learning about diabetes today, specifically type 2 diabetes, with Dr. Nadeem Haq, endocrinologist on staff at Mon General Hospital. Kay and I always have the opportunity to ask questions on this program, so that's why we invite you to ask your questions. And Ada is phoning in. Good morning, Ada.
Good morning.
Welcome to the show.
Yeah, I'm glad to be on because I have a question or some questions. What is an autoimmune disease?
Okay, that's a good question. Can you hear me?
Yeah, she can.
Yes.
Fine.
Okay. The immune system is supposed to protect us from viruses and bacteria and all sorts of things. Okay. What happens that in some patients and some individuals, this immune system becomes defective. Okay. And it mounts a reaction against our own tissue, our own organs. Okay. And this process is called an autoimmune disease, meaning that your immune system is working against you instead of protecting you. Okay. And autoimmune diseases are more common in women, and like lupus, for example. That's a very well-known autoimmune disease. So basically something goes wrong with your immune system and it turns against you.
Well, what do you do for? I mean, my daughter has it, and she's going to to a doctor, and she takes all kind of medicine, but her joints just ache all the time.
Okay. She probably has rheumatoid arthritis, which is one of the common autoimmune diseases. Usually, we use steroids for autoimmune disease.
Yes, she's on steroids.
Yes.
Can it be reversed, or is she going to have to take these medicines to deal with it?
It depends on so many factors. We have newer drugs, we call them biologics. Okay. If it started early enough, they could reverse the whole process.
That's
well,
encouraging.
Good luck for your daughter, Ada.
Thank you. Well, she's had this now for about a year, and the medicine she's taking doesn't seem to be doing much. And every time she goes to the doctor, her blood work is kind of off kilter.
Well, sometimes it's good to get a second opinion, too. Would not hurt.
Thank you for your call. Good morning, Millie. You're on with Dr. Haq. Go right ahead.
Yes, I had a question. I wonder what you could tell me about what they call the other diabetes, that insipid. I seem to have the symptoms, but I haven't had a test yet. The thirst and the frequent urination and the high blood calcium and all that.
Yeah, it's called diabetes insipidus, or DI. It's totally different from type 2 diabetes or type 1 diabetes, okay? Diabetes simply means excessive urination in Latin. But in DI, or diabetes insipidus, is a disease of the pituitary gland, okay, and there's a hormone called vasopressin, which is supposed to regulate your urination. So patients with DI, they lose their vasopressin and they have excessive urination, okay? So this is very different. DI and type 2 diabetes have nothing in common in terms of pathology or symptoms. You should see an endocrinologist. There are effective treatments for DI.
Okay. All right. Thank you very much.
Thank you.
Thank you for calling, Millie. Your phone calls are welcome at 304-296-0041. So you mentioned every 6 months we should be tested for diabetes if we have those risk factors.
That's correct.
Anytime you're overweight or obese, it likely comes down to lifestyle. You're not getting enough exercise. You're not eating correctly. How important is exercise and losing weight? If you have pre-diabetes and you start exercising regularly and start dropping the pounds, can you ward off adult onset diabetes? Oh, we don't use that term anymore, but you know what I mean.
Yes, okay. That's a very important question. Okay. To answer your question, yes, diabetes is crucial. The weight management is the most important factor in the management of diabetes. Okay. Let me answer your first part of your question about pre-diabetes. Okay. Studies have shown that if you take a bunch of pre-diabetics and put them on a diet and exercise plan, okay, the studies have shown that you can reverse the whole process. You can prevent diabetes mellitus in those patients. Okay. So a modest weight loss will significantly improve your chances of not having diabetes in the future. Okay, I'm talking about pre-diabetics. Okay, if you have type 2 diabetes, full-blown type 2 diabetes, okay, the weight management and dietary management is the cornerstone of type 2 diabetes management. Okay, you don't have to lose 50 pounds or 60 pounds to see any effect of it. A modest weight loss, such as like 5% of your total body weight, will have a profound effect on your diabetes.
Because there's less fat cells for the, what do the fat cells have to do with this as far as the insulin going through the body? If they have to go through a lot of fat cells, then that keeps your insulin from working correctly, right?
What happens that and the glucose has to go into the cells for metabolism to produce energy, okay? But the glucose molecules, the glucose particles, sugar particles, they can't enter the cells for metabolism unless there is insulin. Okay, what happens in type 2 diabetes, there are special channels, okay, those channels are embedded in the cell walls, okay, and each and every glucose molecule has to travel through those channels to get into the cells. When they have insulin resistance, those channels become defective, okay, and there are insulin receptors. There's a special proteins on the surface of the cell wall. They become defective, and they don't respond to the insulin, okay. So this phenomenon is called glucose insulin resistance. Okay, what causes this? No one knows for sure. But the best treatment to reverse the insulin resistance is weight loss.
Yep. So start walking.
Start walking.
Let's talk about ignoring it. Let's talk about those that know they have the type 2. Mm-hmm. They've been diagnosed and they take medication, but they continue not to do what they're supposed to do. Where can this lead you?
Okay. And this is a common question that I get from my patients. Doc, my sugar is not too bad. 150 is 200s. Okay, my A1C is not too bad. And I feel great. Why do I worry about it? Mm-hmm. Okay. The answer to that question is that diabetes can cause serious complications. Okay, it's the leading cause of blindness, kidney failure, amputations of the legs, and heart failure, and heart disease, strokes.
So if you ignore it and continue to do what you do.
Yeah, you're going to have all these complications eventually. There's no question about it.
Yeah, eventually you get bad blood flow to your feet. A lot of people start with amputating a toe.
Absolutely.
Some people a foot. Some people the whole lower leg. I mean, that's the worst case scenario.
Yes.
304-296-0041. Back to Health Talk on WHAR right after this.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Our guest is Dr. Nadeem Haq, endocrinologist on staff at Mon General Hospital. Let's take a call from Ed before we're through today. Hi, Ed.
Hi. I wonder if the doctor would speak to a situation where, like I am, where I've never been obese, but I have diabetes, and the doctor says I'm half 1 and half 2. Type 1.5. Wonder if he'd speak to that.
Yeah, now we are seeing a new class of diabetic patients. We classify them as 1.5 diabetes. Okay, it's something they behave like type 1, but they don't have type 1 diabetes, and they don't fit the criterion for type 2 diabetes either. Okay, so these are type 2 diabetics, non-obese type 2 diabetics. Okay, no one knows what causes this problem, but this is a relatively new phenomenon and has been described in medical literature. And the treatment for these patients is usually the insulin.
Oh, really? So, but insulin is different than insulin a couple years ago. I mean, now they come in pens and things like that. Is that what you have to take, Ed? You have to.
Yes, I'm taking medication plus the insulin.
Yes, I think that's the way to go.
Well, so we learned something new.
Yeah,
1.5, diabetes 1.5.
Had not heard about
Today.
that.
Thanks, Ed, for the call. Very interesting information. And there's a lot of information out there, I'm sure, online or at Mon General Hospital about diabetes. But we want to thank you for being with us today.
Thank you very much.